So this is Module 8 of my final assignment for Advanced Physical Assessment course. Basically, I'm going to introduce myself. I'm Juliana. I'm going to be the nurse today. I'll be completing a full head-to-toe assessment on you. And with your permission, may I start? I'm going to wash my hands. And then I'm going to go through a couple questions in the neurological category first. So I guess the way that I'll do this is I'll explain which category I'm going through, and then I'll discuss how I'm going to assess those categories and go from there. So the first category will be neurological, and essentially when I walk into the room, I'm going to again introduce myself and then ask you what your name is. I'm going to ask you where you are. Do you know where you are? Do you know the date and the time today? To establish my GCS of 15, alert and oriented times 3. I'm going to also ask if they have any pain. Are they in any obvious form of distress? And then I'm going to obtain their vital signs. We're going to then move on to the head, ears, eyes, nose, and throat. So I will start as a head-to-toe assessment should, head all the way down to the toes. So I'm going to inspect the head, the eyes, the mouth, the throat, the ears. I'm going to look at their bilateral eyes, make sure they have equal hair distribution on the lashes, the eyebrows, no ptosis, no periorbital swelling. Their conjunctiva is pink with no lesions. The sclera is white. Inspect their nose, their nasal mucosa, ensure that it's pink and moist, and their septum is midline. I'm going to palpate the sinuses and ensure that they're non-tender to palpation. Palpate the thyroid as well, ensure that it's smooth with no nodules, no goiters are present. And then I'll palpate the scalp as well, ensure that there's no masses and no abnormalities present there or any pain upon palpation. I'll use an otoscope. I'll assess their tympanic membrane, ensure that it's pearl gray and intact bilaterally. I'll use a pen light, and I will ensure that the pupils are equal and reactive to light in accommodations. And then I will do my accommodation and peripheral vision testing. And then I'll assess their visual acuity using the Snellen chart. I will do the whisper test, ensure that the words are heard the same bilaterally as well. And I will also check their gag reflex and ensure that that's intact. Look in their throat, ensure that the tonsils are 2+ bilateral as well. And then I'm going to assess the range of motion with the neck and the neck strength. The next system we'll go into is respiratory. We're going to inspect anterior and posterior chest, look for symmetrical expansions. We'll palpate for tactile firmitis, anterior and posterior as well. Percuss interior, posterior chest, and then auscultate the posterior and anterior chest. Listen for appropriate breath sounds, ensuring that there's no coughing, no wheezing, or any abnormalities present there. No crackles. We'll use the incentive spirometer to assess the expiratory forced vital capacity and the forced expiratory volume within 1 second to get us a baseline there. After the respiratory system, we move into the cardiovascular system. So we'll assess capillary refills on their fingers and their toes, ensure that it's less than 3 seconds. We'll look for jugular venous distension. Inspect for any edema in the legs, ankles, feet, any swelling there. And then we'll auscultate the cardiac points, ensure that we have S1 and S2 present, make sure that there's no murmurs that are heard, no gallops, no rubs. We'll auscultate the carotid arteries and ensure that there's no bruits present. And then we will palpate the bilateral peripheral pulses. Of course, asking questions if there's any chest pain, any history of palpitations, any anxiety, any chest discomfort or pressure. Those are also some questions that we ask while conducting the physical assessment portion. Obviously, if there are any abnormalities or abnormal findings, then we move on to ECGs and further testing for cardiac symptoms. The next system that we'll be going through is the gastrointestinal system. So we will inspect the abdomen, ensure there's no visible masses, no scarring, no lesions. We'll auscultate the abdomen, listen for any hypoactive bowel sounds in all four quadrants. Once the auscultation is done, then we can palpate the abdomen. We can do soft palpation, light pressure, ensure that there's non-tender, no distension present. Then we can do deeper palpations afterwards. We can then percuss the liver span and ensure that the size and the border of the liver is accurate and there's no enlargement. And then we can percuss the abdomen and listen to ensure that we have those tympanic sounds throughout the entire abdomen. We can ask questions about their last bowel movement, any nausea, vomiting, constipation, diarrhea, things like that while we're doing the physical assessment as well. And then I guess GU, I know gastrointestinal, GU kind of go correlated. We can also ask about any UTI or urinary symptoms that can kind of go hand in hand with gastrointestinal as well. And then for musculoskeletal, we will palpate peripheral pulses again, we'll do peripheral pulses, but then we're also going to do your femoral, popliteal, tibial, and pedal pulses as well. We will assess the hands, the shoulder strengths, adequate range of motion for those, range of motion within the wrists, the elbows, the shoulders, the biceps, assessing the knees, the ankles, your hip strength, and then range of motion for those as well. And then range of motion for the spine as well, bending over, trying to touch your toes and ensuring the spine is symmetrical and there's no curvature in the spine. And then obviously while we're doing these assessments, we ask, do you have any pain, listening for any cracking, looking for any swelling, discoloration, obvious deformities, and things like that. Then I just wanted to go back to the neurological systems again because we can't get everything. Neurological assessments can be pretty long and detailed. Obviously, for a basic head to toe assessment of a patient just coming into the hospital in this instance, Miss Jones, it's going to kind of be a more basic head to toe assessment. If there's obviously any abnormal findings or abnormalities, I would go into further depth, but just touching back upon neurological now, I would assess the lower pain, the light touch response, the deep tendon reflexes on both upper and lower extremities. You can also test for graphesthesia, so I can draw an 8 on their hand and they can close their eyes and tell me what I've drawn, or an A on their hand. And then another one is stereogenesis, so I can place like a paper clip in their hand, have them close their eyes, and then they can tell me what's in their hand based off of their feeling. So those are some neurological tests that I would do if I, saw some abnormalities at the beginning of the assessment. Also, the cranial nerve testings is also something. It wasn't on the Shadow Health final assignment, but I do remember doing it in the neurological component of this Shadow Health experience. And if there's ever any abnormalities, as mentioned, again, I would go through the cranial nerve test functioning and just make sure that their cranial nerves are all within normal limits. And then the final thing that I would do is inspect the skin, hair, and nails. Inspecting the hair, any dandruff, but any also abnormal hair on the belly area, any thick, coarse hair as well. I would also inspect the fingernails, ensure there's not a lot of ridges and no abnormalities like clubbed fingers, clubbed toes, things like that can mean further investigation. And then inspecting the skin is also something that I would do, but of course I would do that throughout my entire assessment, but this is just something that is a little bit extra. So, looking for acne. In this case, Ms. Jones did have acne, some striae, so the stretch marks on the abdomen and the sides of her hips. She did have some excessive hair growth in the umbilical area, any discoloration or abnormal moles that have changed in color, changed in shape, things like that to be looking for as well. So that's basically summarizing my entire assessment that I would do. And I think that throughout the shadow health assessment, this gave me a very clear indication of Miss Jones's health, and then what to kind of go from there. If I've seen some abnormalities with her, I would go forward and order or do further testing. So diagnostic imaging, for example, ordering different lab works or lab values, and so forth, dependent on what was abnormal or not. But all in all, this was a really great course. I thought that it was super interactive, very, very beneficial to learning. I like that it was interactive just because it wasn't just writing papers and whatnot. You had to actually do the assessments. You actually had to understand the material and the content. And I found this course probably the best course that I've taken so far. So this was a really good experience for me, and I'm really happy that I took this. So thank you so much for having me in your class. And yeah, I look forward to finishing this program and carrying on with my nursing career. So thank you. And